my patient Garfield. He is a 6-month-old, 2 kilogram domestic medium hair. He's in today for his pre-surgical blood work just before his neuter next week. So I will first start off my exam by doing the hands-off part. So he seems pretty friendly and he is eager to get into the room, so I will let him walk around the room and I can check out his gait and his posture and see if there's anything going on with his limbs. And during this time, hands-off time, I can check out to see if he has any auditory visual defects, so I can, if I move, do his eyes move towards the movement? And if I make any noise, does he respond to it? I can also do 2 out of the 3 parts of the body condition score. So if I'm looking at the side, I'm looking for a tucked up belly, which he does have. And if I'm looking from the top, I'm looking for a slight hourglass shape, which he also does have. So this is looking more and more like a 3 out of 5 for body condition score. So at this time, I could check for respiratory rate, so I'd sit and watch the rise and fall of his chest, but I can't really get a proper number because he's purring too much. So I will just continue with the physical assessment. So I'll start at the nose, and I check for any scratches, discharge, anything funky going on with the nose, and I palpate the skull, check for symmetry, and I'm checking at the eyes at the same time. So I'm pulling down the lower lid and checking the conjunctiva, any scratches, foreign bodies, same thing on the other side, and his mouth. So I check the capillary refill time, and it's under 2 seconds, so that's great. Checking out his teeth, and he's only 6 months old, so he's got great teeth, and his tongue, and everything looks fine there. And then I'll work my way up to his ears, and this guy's missing an ear, actually. Oh, hold on, here's his ear under the hat. So I'm lifting up the pinna, and I am checking for anything kind of out of the ordinary, and I'm seeing some dark brown matter in the ears, and it's kind of crusty, and it looks like they're itchy because there's a few scratches. So, and in my hands off, I would have seen him scratching too if he'd had done that, and it had been itchy enough. So at this point, I'm going to take a minute and write down what I need to. So I'm going to check off what is fine, which is eyes and ears, and the eyes and the nose. And then I will circle ears and write down what I find. So now that I'm done with the head, I will just continue on with the physical assessment. So I'll start at the neck and find the submandibular lymph nodes, see if I can find them, which I can't, which is fine. And then I'll work my way down to the front part of the shoulders and see if I can find the prescapular lymph nodes, which I can't, which is fine. That's awesome. Everything around the neck looks pretty good. The skin starting to see some what looks like flea dirt. So I would write that down, but I'm just going to continue with the thorax first and see what else I can find, if I find anything, and then I'll stop at the thorax, take my heart rate and respiratory rate, and then I will write down everything. So as I'm going, I can go into the armpits and find the axillary lymph nodes, and I can't really feel those, so that's fine. And I'll work my way down each limb, checking for mobility and the paw, the pad of the paw, the claws, the condition of the skin, any lumps or bumps, kind of similar to every other part of the body other than the claws and pad part. So same thing on the other side, mobility, paws, claws, or pad, claws, lumps, bumps, hair, coat condition, which that's all fine. And then I'll keep going with the ribs, and I'll try to work my way down. And right now what I'm feeling is great, so the ribs seem fine. This guy is probably definitely a 3 out of 5 body condition score. which is great for him. That's awesome. Everything else looks fine other than there's still some flea dirt. So right now I will do my heart rate and respiratory rate. So I will try to count for 15 seconds. And I can find the heart where the elbow meets the ribs. I'm just doing that on the left side. So he was purring a lot, so I couldn't get a proper respiratory rate, but that's 20 to 40 breaths per minute for normal animals. And I did get a heart rate, which I counted 60 beats in 15 seconds, which is 240 beats per minute, which is at the high end of normal. So for kittens, it's between 160 to 240 beats per minute. So even though that's normal, I'd probably still write down that it's the high end of normal, just so that's kind of noted in there. So now that I've done that, I'm going to write down everything that I saw. So flea dirt, couldn't get the respiratory rate, and the heart rate. So now that I've taken the heart rate, respiratory rate, and wrote down that I saw some dirt, I will continue with the abdomen. So I'll come around and I'm squishing the abdomen to see if I can find any unusual lumps or bumps or anything that I think is abnormal right now. And I'm still checking out the coat condition, and I still see some dirt. And as I'm getting closer to the hips, I will check out the inguinal lymph node, and I can't find that, so that's awesome. And working my way back, I'm noticing in front of the tail there's some missing hair, and it's just really thin in that area, so it looks like he's been scratching quite a bit. Same kind of way it was on his ears. So I will write that down once I get towards the end, but I'll just continue on. I'll just kind of note that in my head. I'm checking out the hips and the spine just to see if there's anything, any random curvatures or anything like that, if the hips are symmetrical and stuff like that. And they look fine. He's pretty healthy looking young cat. And now I will work my way down the limbs. So same thing as the front leg, just mobility, coat, claws, pads, anything like that. While I'm here, I'm going to check out the popliteal lymph node kind of in the back of the knee. And I can't palpate that, so that's fine. Same thing on the other side. And that's great. So before I get to the rest of it, I'm just going to quickly write down that there was some missing hair in front of his tail. Alright, so now that I'm looking at his tail looks fine. It's a little bit stubby looking, but that's not something that I'm going to be concerned with right now. And I'll check out the urogenital region. So he's still a male, still unneutered. Everything else looks fine. It's the kind of patchy hair, but other than that, everything looks fine. And so now the last step is just temperature. So I have my thermometer and I've looped it up so everything should be as comfortable as getting something shoved up your butt can be for a cat. So I'm going to lift up the tail and make sure that I get the thermometer in there as much as I need to, and I'm waiting for it to beep. So it beeps and I can pull it out and I can read it, and it comes out to 38.9 degrees Celsius, which is good because normal is 37.5 to 39.5 degrees Celsius. So he's doing very well.